Okay, so let me have the diamond knife. I'm going to turn your head to the right. There you go. So once again, we just really want to remove skin because our diagnosis is dermatocalasia. She doesn't have any excess muscle, no excess bulging fat. So we'll be very precise in how we remove skin only, leaving the orbicularis intact. That's why it's nice to keep a sharp knife. And we've got another delicate instrument here, a needle tip cautery that's on a low setting, and so we can come back and get hemostasis. So there shouldn't be very much bruising associated with this procedure. This bruising that's here is from the injection of the local. So we removed the black skin, and we were precise and careful not to injure the orbicularis muscle. We used our needle tip cautery to stop any bleeding so there wouldn't be bruising afterwards. And now we're going to suture things closed. I like to use a fine 6-0-proline, which is a non-absorbable monofilament suture that will take out in 4 or 5 days. And I think that approach has less inflammation and therefore better scarring. And just carefully put all this back together. So it's nice to have these beautiful, delicate instruments. And so, you know, when you do a delicate procedure, it's nice to have a knife that's super sharp and just as delicate as the rest of the instruments we use. The thing I love about the diamond knife is I've had it for a year and it stays sharp, and they're a little expensive, but once you have it, as long as you take good care of it, and should note that you have to be careful not to bang it against anything hard like metal in your retractors, or your staff needs to understand that it's a special instrument that's cleaned and cared for in a special manner. And the integrated protective sheath goes a long way to keep you from having any problems with dulling the blade as well. So you can see our patient is comfortable and relaxed and not in pain and sleeping like she would sleep at home. We usually tell our patients that for this first week to avoid salty foods and to drink plenty of water and no strenuous work or exercise, and also to keep their head elevated. And that means at night 2 pillows and then cold compresses so that the bruising and swelling is minimal and resolves quickly. So you can see this is coming together nicely. So we're just finishing the other side, and upper lid blepharoplasty is one of the simplest, easiest operations in plastic surgery to recover from, but it can have a profound effect on your appearance because the eyes are the center of your face, and it's often the first thing that shows age is when these upper lids get a little loose. Of course, the eyes are very important in function, and so we have to be careful to make sure that our desire for youthfulness doesn't affect function, and that's why we've been very precise today and removed only the skin. A generation ago, upper lids, or blepharoplasties as they're called, were more stylized, and every patient, no matter what, had skin, muscle, and orbital fat removed, and these days we're more precise in putting together a plan for each patient based on their needs. So That's why upper eyelid surgery is one of the best values in plastic surgery, because it has a profound effect on your appearance. It's easy recovery and usually not a lot of cost.